Now, Dr. Brian Hemstreet is one of those pharmacists and is joining us today. And you are going to be talking about something called polypharmacy, which not everyone might know about. So
correct.
What exactly does that entail?
Yeah, well, thanks for having me here today.
Of course.
So polypharmacy is unfortunately a situation that a lot of patients are running into nowadays, where there's an excessive amount of medications prescribed to patients for multiple conditions, where they end up on medications for which there's not an indication. Or sometimes it's defined as patients on more than 4 to 5 medications at any one given time.
And some of the examples you were giving during the ad break may not be that unfamiliar for people too.
No, of course, though, some of the common conditions that we see in the United States now, like diabetes and high blood pressure, it's not uncommon for patients to be on 2 or 3 of those medications for each of those conditions. Patients can then end up on the upwards of 7, 8, 9, or 10 medications at one point.
How does that happen? Because I'm assuming a doctor is prescribing this, trying to control the symptoms of these different diseases.
It's true. So often patients, how this happens is often patients are seeing multiple prescribers. So they may see a primary care doctor, and then they may go to a specialist for either their high blood pressure or their diabetes. Each of those prescribers are then prescribing medications for their respective conditions. And before you know it, the patient ends up on multiple medications for multiple conditions.
Whose responsibility is it to raise the red flag saying this might not be the best thing?
Yeah, so it's definitely a patient. The patient, as they get into the system and get on multiple medications, should obviously, the patient or their caregiver, keep an eye on the medication list. There's also a role for the pharmacist as well, as the patients coming and filling their prescriptions, as that's often one central place where all medications are going through. So there's a potential role there as well.
Is there a solution to this or something that can help people who are on multiple medications?
Yeah, so I think it's always a good practice as patients, particularly who are seeing multiple prescribers, have an intermittent review of their medications, and certainly a pharmacist can facilitate that. And then as the medications are gone through, there is a process by which they are assessed to see whether or not they're still needed, if they're having the intended effects, or in some instances that they're having adverse effects that may be causing the patients to have additional medications added on to treat those adverse effects.
Right, and then at some point the medication can conflict with each other as well,
Correct.
which you want to avoid.
Correct, so patients become at risk for interactions between different drugs, and then additive effects amongst different drugs, which can cause various side effects and leads to things like hospitalizations and falls, and excessive interactions with things like alcohol too.
And really quickly, before we wrap up here, how often would you say this is happening?
It's pretty common. So if you look particularly in the aging population or patients with conditions like diabetes, high blood pressure, chronic kidney disease, it's routine to see patients on 6, 7, or 8 medications and seeing multiple prescribers. So as patients get older, they get multiple medications, then you see it happen more often, yes.
All right, well, thank you for coming in. This is some really useful information and something that hopefully people will take to heart and ask questions if they need to.
Great.
We will send it back to you, Tom.